What if I told you that something you do in the privacy of your bedroom could dramatically reduce your risk of prostate cancer by up to 33%? Stay with me because this revelation might change how you think about men's health forever. Hello, beautiful souls. I'm Dr. Katalyn Cari, and I'm so grateful you've decided to spend part of your day with me. Before we dive into this incredibly important topic, I want you to know that if this information helps you or someone you love, please hit that like button and subscribe to our channel. We're building a community here where we can openly discuss health topics that matter most to you, and your support helps us reach more people who need this vital information. Also, drop a comment below and let me know what health topics you'd like me to cover next because this channel is truly for you. Today, we're going to have an honest, scientific conversation about something many men, especially those over 60, wonder about but rarely discuss, even with their most trusted physicians. We're talking about intimate health and its profound connection to prostate wellness. This isn't just about personal pleasure. It's about your longevity, your quality of life, and potentially preventing one of the most common cancers affecting men worldwide. I want you to imagine we're sitting together in my consultation room, having a heart-to-heart conversation. There's no judgment here, no embarrassment, just science-based facts that could literally save your life or the life of someone you care about. What you do in your most private moments might have a direct impact on how many years you live, and more importantly, how well you live those years. Let me start by introducing you to the star of today's discussion. Your prostate gland. Picture this small, walnut-sized organ sitting just below your bladder. Think of it as a specialized factory with one crucial job, producing a vital component of seminal fluid called prostatic fluid. This isn't just any liquid. It's a sophisticated nutritional cocktail containing zinc, citric acid, and essential enzymes that protect and transport sperm cells. But your prostate doesn't work alone. Semen production is truly a team effort, and understanding this process is key to everything we'll discuss today. The seminal vesicles contribute the largest volume, providing a sugar-rich fluid that gives sperm the energy they need for their journey. The testicles contribute only about 1% of the total volume, but it's the most critical component, the sperm cells themselves. All these elements combine to create seminal fluid. Now, how does this amazing process actually work? Ejaculation is a fascinating two-act performance that your body orchestrates with incredible precision. First, we have the emission phase, where all these fluids gather in the urethra, ready for their grand exit, like actors waiting behind the curtain before their big moment. Then, with proper stimulation, comes the second act. Expulsion. Here, the pelvic floor muscles contract with tremendous force, propelling the semen outward. This perfect ballet depends on flawless communication between your nervous system and your muscles. That's why conditions like diabetes, or as we'll discuss later, certain prostate surgeries, can disrupt this delicate process. Your body is truly a marvel of biological engineering. Now, let me address a question I hear frequently in my practice. Dr. Cari, is it harmful to abstain? Can accumulating semen be dangerous? I want to give you a direct, honest answer. There's no evidence that not ejaculating causes serious illness by itself. However, this doesn't mean abstinence is without consequences. Think of a river that stops flowing. The water becomes stagnant. Something similar can happen in your prostate. For men suffering from chronic prostatitis, a persistent and sometimes painful inflammation of the gland, infrequent ejaculation can actually worsen symptoms of pelvic congestion. In fact, a significant study from 1999 observed that increasing ejaculatory frequency, whether through partnered intimacy or self-stimulation, helped many men alleviate symptoms of this uncomfortable condition. It's as if ejaculation cleanses the ducts, reducing pressure and inflammation. There's an additional benefit that many people don't consider: sleep quality. Ejaculation releases a cocktail of hormones including prolactin and oxytocin that naturally induce relaxation and sleep. Recent research Published in 2023 in the journal Sleep Disorders, found that sexual activity, especially when culminating in orgasm, significantly improved both sleep onset and sleep quality. So beyond pleasure, an active, intimate life might be your best natural sleep aid. But now we're approaching the point I know many of you have been waiting for, the topic that generates the most questions and concerns. Does infrequent ejaculation increase prostate cancer risk? Or, put another way, does more frequent ejaculation provide protection? Science has been investigating this question for decades, and the findings are, to say the least, absolutely fascinating. Let me take a moment here. And while I do, I want to ask you for a small favor that means the world to me. If you're finding this information valuable, please take just a second to hit that like button and subscribe to our channel. It's completely free for you, but for me, it's tremendous support that allows me to continue creating evidence-based health content for our growing community. Thank you from the bottom of my heart. Now, let's continue with what might be the most important study ever conducted on this topic. Researchers at Harvard University followed nearly 32,000 men for 18 years. What did they discover? Something truly remarkable. Men who reported ejaculating 21 times or more per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. Here's a crucial detail that I find particularly significant. The study concluded that the method of achieving ejaculation didn't matter. It made no difference whether it was with a partner or through self-stimulation. The protective effect seemed to be linked to the physical act of ejaculation itself, not specifically to partnered sexual activity. This finding removes any stigma or judgment from the equation and focuses purely on the biological mechanism. Multiple other studies have replicated these findings. Research conducted in 2017 and a comprehensive meta-analysis in 2018 confirmed this inverse relationship. Higher frequency correlates with lower risk. Now, as a scientist, I must be completely transparent with you. These studies are observational and rely on what men remember and report, which can contain errors. However, the consistency of results across multiple large-scale studies is so compelling that it demands we ask the crucial question: why does this happen? So what's the secret mechanism behind this potential protection? There isn't just one answer, but the scientific community has developed several fascinating hypotheses that I want to share with you. The first and most intuitive theory is what we call the flushing hypothesis. Imagine your prostate as a sponge with tiny channels throughout. Over time, potentially harmful substances, carcinogens from environmental exposure or tobacco use, can accumulate in prostatic fluid. Each ejaculation functions like a cleansing rinse, expelling these substances before they have time to damage cells. When ejaculation doesn't occur frequently, these toxins remain in longer contact with prostatic tissue, potentially increasing the probability of mutations that could lead to tumor development. The second theory involves hormonal regulation. Frequent ejaculation might help maintain a healthier hormonal balance within the prostate, regulating testosterone levels and other androgens, which in turn controls excessive cellular growth. This hormonal balance is crucial for preventing the kind of uncontrolled cell division that characterizes cancer. A third idea that I find particularly intriguing is that sexual activity functions similarly to physical exercise for your immune system. It stimulates your body's defense army, which fights not just against viruses and bacteria, but also against cancerous cells. An active immune system is more effective at detecting and eliminating abnormal cells before they become problematic. This immune boost could be one of the most significant protective mechanisms we're observing. Finally, researchers believe that the muscular contractions during orgasm improve blood flow throughout the pelvic region, reduce local inflammation, and decrease oxidative stress, a key factor in aging and cancer development. These physiological changes create an environment that's less conducive to cancer growth. After hearing all of this scientific evidence, I know the million-dollar T. Question you're thinking is, Dr. Cari, so how many times should I ejaculate per month? I want to be crystal clear on this crucial point. Although the study mentions 21 times, that number is not a medical prescription. It's not a goal you should force yourself to achieve. Sexual health is not a competition, and I cannot stress this enough. The ideal frequency for each man is completely personal and depends on countless factors: your age, your overall health status, whether you have a partner, your stress levels, your emotional state, medications you might be taking, and so much more. The list is truly endless. Forcing yourself to reach a specific number can actually generate anxiety and stress, which is completely counterproductive to your health goals. What these studies suggest isn't an obligation, but rather a concept. A sexually active life and regular ejaculatory frequency appear to be components of a healthy lifestyle that may protect the prostate. The key is listening to your body and finding your own natural rhythm without pressure, guilt, or unrealistic expectations. I'd love to hear from you in our community. What do you think about this research? Do you believe there's a normal number, or is it something completely individual? I genuinely enjoy reading different perspectives from our viewers, and your insights often help other community members feel less alone in their health journeys. Now let's address a crucial topic that concerns countless men. What happens to ejaculation if you need prostate surgery? This is where understanding the difference between two main types of surgery becomes absolutely essential, because their consequences are dramatically different. First, let's discuss surgery for benign enlargement, also known as benign prostatic hyperplasia or BPH. This is the most common prostate procedure. As men age, the prostate naturally grows and can compress the urethra, making urination difficult or incomplete. Surgery aims to unclog the pipe by removing the internal tissue, causing the obstruction, while leaving the outer prostate capsule intact. The most frequent consequence of this surgery is something called retrograde ejaculation. What does this mean for you? During orgasm, instead of semen being expelled outward, it travels backward into the bladder. This occurs because surgery alters the small internal sphincter that normally closes to prevent this reverse flow. Here's what's crucial for you to understand. You will still experience orgasms. The sensation of pleasure remains the same, and your ability to achieve erections shouldn't be affected. You simply won't see semen expelled. This semen is later eliminated harmlessly with urination. As a physician, I consider it my duty to always explain this before surgery so patients aren't alarmed or frustrated afterward. The second scenario is quite different: surgery for prostate cancer, called radical prostatectomy. Here, the goal is curing cancer, and to achieve this, surgeons remove the entire prostate along with the seminal vesicles. By eliminating these organs, semen production disappears completely. Therefore, after this surgery, there is no ejaculation. You may still experience what's known as a dry orgasm, but there will be no fluid expulsion. Additionally, this surgery is more complex and carries two significant risks: urinary incontinence and erectile dysfunction, because the nerves responsible for erections run very close to the prostate and can be damaged during removal. Fortunately, with modern techniques like robotic surgery, we can sometimes preserve these delicate nerves and dramatically improve outcomes for our patients. After everything we've discussed today, I want you to leave with one clear and empowering message. There is no magic formula for preventing prostate cancer. No miraculous diet, no secret supplement, no magical number of ejaculations will guarantee you'll never develop this disease. However, the most powerful tool you have is prevention through regular medical monitoring. Getting your annual checkups with a urologist, measuring your prostate-specific antigen or PSA levels, and having digital rectal exams when your doctor recommends them, this is what can truly save your life by detecting any problems early when they're most treatable. That said, maintaining regular ejaculatory frequency does appear to be beneficial, but please consider it as just one piece of a much larger health puzzle. What are the other pieces that have been scientifically proven to be crucial for prostate health? Don't smoke. Tobacco use has been linked to more aggressive forms of prostate cancer and worse outcomes. Maintain a healthy weight through balanced nutrition and regular physical activity. Obesity is associated with increased risk of aggressive prostate cancer. Eat a balanced diet rich in vegetables, fruits, healthy fats like those found in fish and nuts, and minimize processed foods. The Mediterranean diet pattern has shown particular promise for prostate health. Most importantly, move your body regularly. Sedentary lifestyle is one of the greatest enemies of your prostatic and overall health. You don't need to become a marathon runner, but regular moderate exercise, whether it's walking, swimming, cycling, or any activity you enjoy, can significantly impact your long-term health outcomes. Please be extremely cautious of internet charlatans who promise miraculous cures or claim that conventional medicine is hiding simple solutions. Your health is serious, and it deserves evidence-based care from qualified professionals. If you want to learn more about how to start your prostate screenings or what PSA results really mean, I encourage you to explore more content here on our channel, where I break down complex medical topics into understandable, actionable information. I want to thank you from the bottom of my heart for joining me today, for your time, and for trusting me with such personal health information. If this video has been helpful, if it's answered questions you've been carrying, the best way to support our mission is by hitting that like button, sharing this with a friend or family member who might benefit, and subscribing to our channel. Your support allows me to continue creating honest, science-based health content for more people in our community. Remember, you have the power to take control of your health. Knowledge is the first step, but action, regular checkups, healthy lifestyle choices, and open communication with your healthcare providers is what transforms that knowledge into protection. I'll see you in our next health conversation, where we'll continue building this incredible community together. Take care of yourselves, and remember, your health matters not just to you, but to everyone who loves you. Until next time.